So the question is 16 is which of the one of the following statement is correct about the mesenteric cyst? So A, it occurs most commonly in children less than 18 years of age. No. It occurs most commonly in adults with a mean age of 45 years. So mean age of 45 years. So A is incorrect. So A option is wrong. It is more common in males as compared to females. The B option, no. It is twice as common in women as is common in females as compared to males. So second option is again wrong. Coming to third option, it presents most commonly as a painless abdominal swelling. Yes, it is correct. Then percutaneous aspiration with injection of sclerosant is the preferred treatment option. No. The treatment option for the mesenteric cyst is first is enucleation of the cyst, and then we go for the bowel resection so as to ensure that remaining bowel is viable. Generally, bowel resection is needed in 50 to 60% of children and about 1/3 of adult. If we cannot perform enucleation or bowel resection because of the location or because of the size of the cyst, then we go for the third option, which is partial excision with marsupialization of remaining cyst in the abdominal cavity. After this, the cyst lining should be sclerosed with 10% glucose or diathermy or iodine tincture so as to minimize the recurrence. So D option is again wrong. So the correct option is it presents most commonly as a painless abdominal swelling. So now coming to reference, so it is again from the box from the Bailey. So mesenteric cyst clinical features. Cysts occur most commonly in adults with a mean age of 45 years. This was asked in question. Twice as common as in woman as in man. So again this was asked in question. Its incidence is very rare. It is around 1 per 1,40,000. Now it is approximately 1/3 of cases occur in children younger than the 15 years. The mean age of children affected is 4.9 years. Now the most common clinical presentation which was asked is a painless abdominal swelling with a characteristic physical sign. So what is the characteristic physical sign? That there is a fluctuant swelling near the umbilicus. The swelling moves freely in a plane at right angle to the attachment of mesentery. This is known as a Tiller's sign. That is what is Tiller's sign. So this is the attachment of mesentery, this dotted line. So the cyst can move freely in the direction of the arrows. So at the right angle to the attachment of mesentery, they can freely move, and this is known as the Tiller's sign, which can be asked. So there is a zone of resonance around the cyst. So this is the most common presentation, that is painless. But the other presentation can be that it can be associated with abdominal pain. So there can be recurrent attacks of abdominal pain with or without vomiting. Why is there pain? Pain results from a recurring temporary impaction of a food bolus in a segment of the bowel which is narrowed by the cyst, or possibly from the torsion of the mesentery. So these two reasons can lead to the pain in the mesenteric cyst. And acute abdominal catastrophe. Why there could be acute abdominal catastrophe? Due to torsion of that portion of the mesentery containing the cyst, or there can be rupture of the cyst, often as a result of a comparatively trivial accident, or there can be hemorrhage into the cyst, or there can be infection. So this is about this question. So correct answer will be it presents most commonly as a painless abdominal swelling.